As outlined in the book, there are 4 dominant attachment styles that children may develop. These attachment styles tend to vary in the degree of anxiety that is present and the level of avoidance that a child might experience with their caregiver. Someone who develops a secure attachment style tends to exhibit low levels of avoidance, so they are okay being around their caregiver, and they also exhibit low levels of anxiety. These children tend to be more trusting of their caregivers. This is different than an avoidant attachment style, who might lack that anxiety but does not feel the need to be near their caregiver. In other words, they exhibit higher avoidance. This child might come across as cold, but they might also come across as more independent. On the high anxiety side of the spectrum, a child who exhibits high anxiety with low avoidance is generally considered to have a resistant attachment style. This child will come across as a little bit more ambivalent. They might be afraid or unwilling to trust their caregiver, yet they still want to be near their caregiver. Individuals with this resistant attachment style might come across as clingy. They're afraid if they leave their caregiver that their caregiver might not return, hence that higher level of anxiety. Our final attachment style is disorganized. These are individuals who tend to exhibit both high levels of anxiety as well as avoidance. Individuals who experienced abuse in childhood might actually develop this disorganized attachment style, where they are in fact fearful of their caregiver. Thus, they desire to avoid that caregiver.